kind of introductions for this talk. So we have our first talk from the programming committee and from the Women in Medicine subsection that we have for this. Introductions for this talk, we have Jordan Nowak, who will be running the talk. I'm programming committee chair, and I'll be kind of moderating the chat and then asking questions if you don't feel comfortable asking them, or Jordan will ask them on your behalf as well. And then we also have Dr. Usman, who will be leading this talk along with Jordan. And then additionally, regarding this talk, so it will be recorded for people to view at a later date. That'll be uploaded to our virtual resource center. So that way, if you have friends or people that weren't able to make this talk, they can view it at a later date and then do it at their own leisure. And then we'll send up information as far as when that talk will be uploaded and kind of more information. Without further ado, I'll go ahead, transition, hand off over to Jordan.
So I have a few questions that I'll go through. But if you guys have questions, just feel free to just ask them or put it in the chat and we'll get those answered. But first and foremost, Dr. Rehman, do you want to just give an intro about yourself and what you do in orthopedic surgery?
I can. Hello, everyone. My name is Usman Rahman. I am a orthopedic hand surgeon. I live in Michigan and I have a private practice. I am affiliated with two residency programs, McLaren, Macomb, McLaren, Oakland. I train, male and females. They have both here in both the programs and stuff. So it's nice. I have three children. My oldest is a third year in medical school. My second one is a second year in medical school, and my youngest is just finishing up in Michigan State and will be starting in July, MSU Comp. So a family of medicine, and I like what I do. I enjoy what I do, and I hope that you guys will feel free, ask me any questions, and I'll be happy to answer.
So I think the first question would be what inspired you to pursue a career in orthopedic surgery, and then what challenges did you face when you were getting started?
Started in practice or started in residency?
Like what made you want to go into orthopedic surgery? Let's start with that first.
So I come from a background of medicine and I had no intention of doing any kind of surgery. I was just doing my general surgery rotation, which was horrible. The residents were not happy, and it kind of came down and I was a fourth year student at that time. And at that time we had to do general surgery, went to trauma, and ortho went to traumas at McLaren. And so I was at a trauma standing in the CT and I realized that surgery wasn't for me. So I told ortho residents I'm canceling my ortho rotation because this is not what I want to do. These people are always miserable. And so I'll switch to something else. And they were like, no, 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 you'll like us. We're not like the general surgeons. Continue with your rotation. So I kind of just fell into it. And the residents were really, a lot of fun. I was the only student at that time, and there was an intern, but he was a family practice, wasn't really interested in ortho. So everything started and began with me. And then on the weekends when I did house stuff and took call as an intern or even as a student, I was spending time with them. And that's where it started. And so that's how my interest developed. When I did the 2, 3 weeks, I think it was, time went by. I enjoyed the surgery. They were, nice and seemed happy. And so I didn't want to do something that's, my whole life I would be miserable, something that people were happy. And that's what I wanted to do. So that's kind of where I started.
Nice. So then what was there any challenges throughout med school or even during residency you faced as being a woman?
So not medical school because there's so many women in medical school, so not like that. But in residency, wow, where to begin? Really, from the very first day, who did you know to get the residency? Before me, there was a female I'm 5'4" and I'm kind of petite, and she was 6'2". She was big. She had a nervous breakdown in her second year and quit. And then right at that point is where I entered. So there was a spot open. She or so everybody she had a connection with one of the primary care docs was her father-in-law, and he was in the chief of the hospital and stuff. So first thing, who did you know to get into the residency? Then, you're never going to get married. You're not going to have children. So it's constant things like that. Somebody was always there to ask, like, how are you going to do it? How will you be able to reduce the hip? So lots of questions. Everybody had a comment, and everybody wanted to tell me what my life would be like.
Do you think that's changing in the orthopedic field now compared to when you were going through residency?
I think so. I think it's changing. I think we have a ways to go still. I was at the AOAO meeting and I met some people there, and they were still telling me that some of the, people, some older, especially men, are telling them, "Oh, are you going to do ortho? You're so small. How is that going to happen?" But, I'm surprised that it still happens. But I guess it's still happening, but it's not as common or as as outspoken as it was before. When I first got engaged, my program director said that was Monday morning, 7 a.m. He's like, "Congratulations, doctor, just don't get pregnant." Right? So those kind of things are not going to happen. There's ACGME now, and there's certain guidelines. So I think that I'm sure you'll still hear it, but it will not be to that extent. And you have repercussions. You can answer back.
Going off family, how do you balance the demands of a surgical career with personal life and then with like having a family?
How do I balance the family?
Yeah.
I think that number one is to have a understanding spouse, right? Somebody that understands what he is getting into from the very beginning. And my husband is a plastic surgeon, so we were both in a surgical specialty. So both residencies were difficult. So it was kind of easy to understand each other's dilemmas or to communicate. We studied together, so that was helpful. When I had my boards and stuff, it was the same thing. We because it was plastics, we could study a little bit of hand together, or if it was time for him to study, it was my time at the same thing. So that helps, and I think that making sure that your partner knows what is involved, late nights, call, this and that. I mean, even yesterday, I'm going to go at 5 o'clock. No, you're going to go at 7 o'clock. Okay, let's eat dinner so I can get to the hospital. Then, oh, by the way, it's going to be maybe 10 o'clock. Ended up being at 6 o'clock this morning, right? So those things happen, and you need somebody that will understand that that is going to happen. And they may have to take care of the house for a little bit, and then you'll pick up other places. So definitely understanding spouse is a good way. Having help in residency, I had a good support system. My family, I got married in my residency, so then my husband along the way, but I have four sisters, my parents, so they were very helpful and very supportive. And that helps a lot. So I think that those are the important things. And as life went on, we had a nanny that came early morning before we went to the OR. And she left when the one of us came home, and we made sure that our OR days were opposite the others. And if you wanted to schedule a case on your not surgical day, then you had to call the other person's office and make sure it was okay, and it would be on our schedule. So that way it was a balance of like, okay, these are your OR days, these are my OR days. Your career is just as important as my career, but we're balancing who's taking the kids or who's going to pick them up, or who's going to be there for the kids in case something happens. And then whoever was doing surgeries that day had no responsibility. So we balanced it that way.
And then in what ways has being a woman influenced your approach to surgery and or patient care?
I don't know. if it's any different because I'm a female, I've always been, so I don't really know what men think in that respect. I just approach it like, if it's an elderly, and I think more so as my parents have gotten older, like how would I help them? What would I want? Same thing when it's children, how would I feel if I was a mother and this was happening? So your own basic life experiences kind of help you along the way and the empathy that you feel of why you went into medicine.
And then have you noticed, or are there any common misconceptions about women in surgery that you would like to dispel?
Well, first of all, just that people tell you you can't do it, you can do it. There's no reason why we can't do it. If somebody tells you you're too small and how you going to reduce a hip or what are you going to do about this? They use ketamine and so can I, right? They have sedation and so do I. So it's no different. I think it will be easier now because a lot of the residents that are the male residents see attendings as females and have co-residents. So that makes a difference as well. And you just have to remember, you got this residency by your own strengths, by your own hard work, and you're here and you have equal right to be there. And so there's nothing that anybody can say or to bring you down. In order to do surgery, I think especially orthopedics, you have to have a little thicker skin. Cry in private, scream in private, but not that I, didn't get upset or cry in front of my program director. I'm, multiple times, but people say a lot of mean things and, that's for everybody in any specialty you go to. So you just have to develop a little thicker skin.
And then are there any other changes or improvements you would like to see in the field to better support women?
I think there's a lot that is changing, and I think through ACGME, those are all good changes. I think that there's always this concept of like, okay, everything kind of comes all at once. You're young, you want to have children, you want to get married, but you got a career to go. And then once the residency's over, now you want to have a practice and those kind of things. They will always be there all at once. Everything just kind of comes. You just have to learn to navigate through that and realize what's more important and where you can compromise and where you can't. And I think that will help you along the way. And then, prioritize your things. I think it's difficult for a surgical resident and especially an orthopedic resident to have children while in residency just because we are, so case-based and, other people are relying on your schedule. I'm sure people have had it and it's not a problem. If there's an illness, you accommodate, but just know that that is something that, maybe you want to prioritize how you're going to do that and stuff. But I think that there is a lot of good changes, and I would I would prioritize going to a place that have accepted women. It's nice to be a first time person, but let me tell you, I have been, and it's okay to be the second or the third also. You don't win anything by being the first.
What skills or qualities are essential for succeeding in this field, especially for women?
What skills? Just know, just same thing as, when you are applying for a residency, you have to still read, no matter whether that's medicine, general surgery, or ortho. You still have to read those same things. You still have to know the classifications and stuff. But the other thing that I think when students are so worried about applying and stuff, everybody is good. Everybody's gotten to this point. We do look at scores and things like that and what you've done. But the number one thing when you go is, do you read? Do you pay attention to what's around you and what we're trying to teach you? And can we work with you? Because it's 5 years. 5 years is a long time to spend that time on a daily basis. So like for me, I have from McLaren, Oakland, I have three second-year residents. So PGY, two who's come and they spend 4 months with me, two in the first half and two in the second half. That's 4 months. If it's somebody that you don't like and you're spending every single day with them for 4 months, it becomes annoying, right? And so we want to know that we can trust you. We can, when we teach you or we tell you to do something, you will follow through with it, and that you're going to get along with others as well. So I think that be yourself when you go on rotations and stuff, and know that, hey, somebody tells you something, you're going to read about it, you're going to be attentive, and know that, and have the confidence that I can read that. And if I don't know it, I'll just say I don't know it, and I'll look it up, and I'll make sure that I follow through with it.
And then what is the best career advice that you've received and how has it shaped your work?
Career advice? I don't know. I don't really haven't ever gotten a career advice. Like I said, I was thinking about doing medicine and probably GI or something like that. But my husband would tell you that he's my biggest supporter and has helped me throughout with whatever I've needed and help and support in that respect. And so I would say that um, just keep going and do what you think is the best and the right choice and right option for you and your family.
Wait a second.
Hmm.
Sorry, I'm looking at the other questions we have on here.
I mean, you guys can ask me questions. Like, I feel like I'm the only one talking here. So feel free to ask any questions.
Do you feel I know you said you have to have thicker skin, which I feel like if you're going to be a woman in any type of surgical specialty, that's the case. Do you feel like you also had to be or have a little stronger of a backbone? I guess, like, did you have the same respect that some men did when you walked into the OR as an intern? And then the other flip side of that is if you ask for a scalpel and you say scalpel, and do you always say, like, can I please have a scalpel? Because a lot of the women surgeon have shadowed before say that some of the scrub techs think they're mean just because we don't say please, and I guess it's in the woman's nature to say please. I know that was
So,
kind of a lot of questions in one.
so there's a fine line with being authoritative and being bitchy, right? And for some reason, nurses are probably our worst enemy. They on the floors, they will complain. In the OR, they may complain. So it's just you do your work, expect that that's going to happen, and they may be a little more unfair and they may be more friendly to the guys than you are. It is like that. It really is like that. But know that you can be firm and you can be like, I need this. But when you are a resident, I would say is that you should say, okay, thank you, right? Thanks for getting that for me, or let me help you. But if I'm an attending, I may say, I need a knife, and I'm more like bullet point kind of person, and so I will just say, okay, I need this, this, and this. So let's have that next. But I'm now 20 some years in practice. So it's a difference, but initially it was like that. I had a couple of nurses in my residency that would be like, okay, go eat, we'll move your patient and bring your patient back, and then I'll call you and tell you that you can come back. So helping me out. And then there's other people on the floors that were really nasty. So it's a fine line. Just realize who you can trust and who you have to be like, okay, tolerate, right? And so just be just be nice, respectful, but you don't have to lay down and let them walk all over you, right? You just want to make sure that when you need to be authoritative, you are. And as a third year, fourth year, you're not going to be like that. It's more going to be maybe internship year or even like PGY 2 or 3. If you build a good foundation where they're like, okay, that person's competent, that person helps us, you'll see that they will help you and move you and help you along the way.
And have you noticed any differences in how patients or colleagues perceive you, compared to your male colleagues?
Initially, I think it was harder to establish as a female. Not with the patients. I've never really felt people say that, oh, you're a female, so how are you going to operate? People have asked, like, have you done these before? Right? How many do you think you've done? I don't know if they have asked other male colleagues of mine or not, but they have asked those kind of things. In my Facebook Women's Ortho, I know that people complain that these things have happened. I haven't seen that as much other than they will say, you've done these, what's your experience in that? As far as other colleagues and stuff, probably the ortho department would be more just because they were not used to having somebody. But that's improved over the years. I've just developed my own niche in that. And being busy, right, is the other thing. So as you get further along, you're getting busy, you develop your own reputation. And for me, even if I wasn't busy, if I'm doing honest work, that's good enough for me. And trying to do the best that I can for my patients. And your reputation will precede you as time goes by. Even if we think it's a big world, it's really not that big of a world.
And then I know earlier you mentioned about starting a family in residency. Do you think they are more receptive to being able to do that, or do you think that's more you should still wait till after residency?
Residency can be fatiguing. And so it depends if you have a good residency, if you have a good pregnancy, you're healthy, or you have complications. So that's really a personal choice. I don't think that I could have had a child during residency. I got pregnant in my fellowship year, and because I was in that whole mentality of my residency and how they were, I was sick for 1 week, and I still went to work, and he was like, you need to go home. And I took that few days off, but I kept my whole entire pregnancy went really well. I had preeclampsia, so he told me that I needed to put my feet up at lunchtime. I said, I can't do that. What am I going to tell my attending? I'm going to put my feet up for an hour while you go work. So I had preeclampsia. I delivered early, but I was healthy and I felt fine. So I worked the whole time and had no issues. I saved my 4 weeks of vacation. So I took off total of 6 weeks, and I made up my 2 weeks at the end before I graduated, because I didn't want anybody to say she took off 6 weeks and took off extra time and didn't really finish the whole thing. So I didn't want any of that. I took my 4 weeks of vacation for the delivery, 2 weeks of vacation to add it onto 6 weeks. And then I made up that 2 weeks. Then the other thing is it depends on your help, right? If you have good help, reliable help. I like I told you, I have a nanny in the beginning. She was with us for 10 years, so it was great. But then she left when they were like in middle school, and that was a challenge in practice. So, okay, I see my last patient, I pick up my bag, I'm running out the door because I had a little drive to go pick them up, and they would be waiting. And then we would pick them up, and I alternated days with my husband who brought them or took them, but sometimes there was always a challenge, like I gotta find somebody else reliable for kids till they get a little older. So you have to have a good support system to pick them up or drop them off or stay with them even. So every situation, I would say, is different in how you can handle. If you can handle studying and taking call and staying up late and being pregnant and having a newborn, then you can do it, but just gotta make sure what kind of help you have.
Looks like there was a question in the chat. It says, do you have any advice on how to deal with locker room talk amongst male colleagues?
In what sense?
Um, I think maybe like I'm not really sure. Emily, do you know what you were meaning by locker room talk? Like inappropriate jokes and stuff like that.
So the question is, what advice for inappropriate jokes?
Yeah, amongst like male colleagues.
So, you're not in their locker room, first of all, but if they make comment or something like that, I would, unless it's totally inappropriate, that's one thing that you can complain about, but otherwise, let it slide. That's my personal feeling is I don't, I make comment now and they say, and I had an attending who was telling, he was a general surgery attending and commenting on telling, a male student, oh, you should, and what are you going to do if you don't get ortho? And I was like, why are you telling him that? Why can't he get ortho? Why would you discourage somebody? And then later on, it was same thing. I heard him about the female, and I stopped him and I said, why would you say something like that? Why would you discourage young women to not go into a surgical specialty? Maybe you don't have a good experience, but I'm living proof. I have had good experience. I have a family. I've been married for almost 29 years. Why would you discourage somebody? So it depends on what stage you are to complain or to say something. I hate to say that, but I feel like um anything that's inappropriate is inappropriate. And if it's really inappropriate, you should say something. You should stand up for yourself. You can comment and say, hey, that's not something that, is appropriate. But you also realize that you got to make yourself your own career, make your own foundation strong so you can move on and help somebody else, along the way with you. So just remember that if they are really inappropriate and it's very personal, I would say something. I would say something, and you don't have to be confrontational, but you could say, God, that really didn't sit well with me, or I think that was a little inappropriate. You can talk to program director or a senior resident if it's a junior resident as well.
I wanted to ask a question about, I guess it's kind of similar to the last one. I'm very outwardly outspoken about my love for ortho, and a lot of times men feel the need to comment on how if I get there, I should go into hand because I'm a woman. So I wanted to know why you specifically chose to specialize in hand surgery and what I should say back to people who say that to me.
So, I you say, well, when I am an orthopedic resident, and I will decide what I like because there's so many things to specialize in orthopedics that being a female has no bearing on it, first of all. Second is there's plenty of women who are trauma ortho, who are oncology ortho, who are sports total joints, you name it. We're in every specialty, foot and hand, foot and ankle and hand. I chose hand because hand has everything ortho. I do arthroscopy, right? So there's sports. I do nerve tendon repair. I do total joints because I replace CMCs, I replace MCP joints, PIP joints. I do a lot of trauma. I can repair and reconstruct ligaments. What else is there? I take out tumors, right? It has a little bit of everything. I can sit down. I work till the day I delivered in each of my children. I enjoy hand. I do the same drills and all of that, but I couldn't see myself hammering away in my 50s. So that was something that I chose. I didn't like the arthroscopy part that all day long I would just be looking up with my scope in my hand, and how would that feel? That was something I didn't want. Or at that time we just started doing ACLs and stuff, and sometimes these guys the water would be like out the door and puddles of water, and I was like, oh, I don't want to do that either, right? But I enjoyed hand. I could see myself doing foot and ankle, and same thing. It's what you want to do. There's women in every specialty of ortho. It's what you see yourself doing. But tell them, when I get to that part, I'll decide what I like, because every specialty has ortho.
A question kind of going off of that one. I know there's not a lot of like robotics and stuff coming into the field, so how do you think that's going to change just women in general in the field?
If you guys play video games, you'll be really good at arthroscopy and these Makos and all this robotic stuff. Because that's what it is. You're sitting there, you've got your controller here, and you're watching through the robot. So I don't have much experience in robot, because hand doesn't have a whole lot of robotic stuff. Arthroscopy, yes. And a lot of the other places are doing a lot of small joint arthroscopy. But I think that the joint guys are using a lot of different robotic stuff. Some are having the precise cuts made with CTs and stuff, and then that tray is brought in. But you still should know how to freehand cut and make those kind of decisions and determinations. In case, your prosthesis falls on the floor, what are you going to do? Or something happens. So that those kind of things can happen. But I think that you guys will be just fine, especially if you play video games. Arthroscopy is going to be easy. Any other questions?
Yeah, I just had a quick question. As a woman of color, did you ever feel that the additional intersection of your identity kind of added an additional barrier or played a different role in your life? I don't know if that's like something that you've experienced, to be like, oh, I'm experiencing racial bias, or I'm experiencing like bias because I'm a woman, and like how that kind of played a role throughout your journey.
I think there's a lot of bias in my being a female. I still, in a lot of places, in one of the hospitals, I'm still probably the only female that has stayed. There's been, like a few attendings that didn't graduate from there, but came after a few years left for various reasons. Nothing in the department, but just personal reasons. As far as it being of color, yeah, I'm sure. On top of that, I'm Muslim. So I don't drink, right? I don't eat pork. So we go to meetings, and my program director would be like, "Dear, that doesn't have alcohol in it. You can eat that." Right. So he would accommodate. He was very nice in that respect. And I think that if I never make it, if somebody asked me that, I would say I never felt that there was any racial bias. If there was any bias, it's because I'm a female. That would be it. I'm not that sensitive, right? And so if that was, I didn't pay attention to it. Anybody else?
I had another question, not so much about just being a woman, but being a DO, did you find that you faced more challenges versus your MD applicants?
So I went to medical school in Des Moines and came back to Michigan for my student rotations and for my internship and then residency. And my fellowship I did at Wayne State, so also in Michigan. Michigan is a very pro-DO state, and it has always been, and we have very strong hospitals and training programs, and now a lot of it is just mixed. So I don't I don't think that I felt that, other than um for training wise. I could do medicine anywhere. My sister is a internist, and she did her residency at Henry Ford, Maine Henry Ford downtown, so which is a MD, very large, very well respected institution. I don't think that I could get into surgery there. right? And I think that that is a very uphill battle. But then at the same time, the chief of, I believe he's chief of hand, not ortho, but chief of hand at least, and chief of the fellowship of hand at Mayo Clinic is a deal. So anything is possible.
I wanted to ask what recommendations or advice do you have for women pursuing orthopedics to find mentors in the field and kind of get advice about what the next steps look like, what to be thinking about, all that good stuff.
So repeat your first part for me.
Yeah, any advice for women seeking out mentors as far as like attendings, residents, getting connected within the field?
See somebody that has more of your similar thought processes, right? And that can really spend that time and answer questions and stuff. I think there's a lot of women out there that can be helpful. There can be a lot of men that can be helpful too. I know that some of my colleagues in one of the places that I work are excellent, really supportive and stuff. And and there's women there in that residency as well. So it's who you can connect with, and you could kind of frankly talk to, or somebody that would have is going through similar experiences as you. But I think that definitely if you want a mentor, I mean, there's the AOA section, women's section has plenty of women in there, so that definitely they would be willing to help and answer any questions and stuff.
I noticed there's another question in the chat. It says, "Thanks for being here, Dr. Rahman. Those sexist comments that you have endured are definitely still happening today. What can we do when someone like the ortho chair or program director makes those comments or asks those questions that are a clear ACGME violation? I feel almost powerless in those situations."
Um, is that happening more in the South, or is that more everywhere? I feel like South is a little bit behind.
I'm not sure.
Okay.
Myra, do you everywhere surprisingly, she said.
Okay. I would say is that is probably not a place you want to go to, right? It's not a place you want to be the flag bearer. But I would say is that maybe, I mean, if he seems like a reasonable person, to just say, I mean, I think you don't have to like argue with them, because some people you're not going to change their mind no matter how they are, especially if it's an older male. But you can say that, give example, like, do you know that so and so graduated and she was 2 years ahead of me, and now she's doing this in ortho. You know that Lansing has a female program director, ortho program director is a Meredith, right? Say that. Say, do you know that, at the AOA meeting or AAOS, how many women there are? Look up that stuff, right? You can say that. Every specialty in ortho has a female. The Hand Society meeting next year has I think there is a female that's going to be the chairperson, like the responsible for that meeting. This year there was one that was a female also. So there are plenty of people. These people are just uneducated or so narrow-minded. And part of that is that unfortunately you're going to have to educate them. We're not a large part, but we're a growing part of the orthopedic family, and we are in every specialty. But if it's a sexist comment and whatever like that, it depends how you feel. You can say, don't be confrontational, but just say, I don't think that that's quite the way it is. Instead of saying that's inappropriate, I don't think that that's quite the way it is, or wow, that I'm surprised to hear you still say things like that. And then when you become an attending, I would go back and maybe let that person know that, by the way, here I am. That's the best revenge, right? When they see that you've made it.
Do your kids want to be orthopedic surgeons?
So my third year, or yeah, my MS3, he did what did he just do? He did family practice, then he did psych, and now he's on medicine. So this is his second day of second week of medicine. So really just started, right? First day he said, wow, that's a lot of work. I don't know a lot of stuff. The next week was like, okay, so I have like two patients on my own. And wow, he's got C. diff and this and that, and that's interesting. Next day was like, wow, there's arrhythmia, and I got to read EKG and murmurs and stuff. Cardiology is really interesting. But next day it was, oh, there was a code, and I was standing right behind the pulmonary critical care fellow, and that looks really interesting too. So we'll see what he does. But they like it. They have the one of the biggest things was like when we picked up our kids, or we went anywhere, we all went together. If we went to grocery shopping, we all went together, the five of us, right? So if I got a page or something, they'd be like, hold on, let me look. Or if I was driving as they were growing up, read that text to me. What does the resident say? Who's calling? Or they would hear on the speaker in the car. So they know that kind of stuff. They worked in my office. My boys mainly, but my daughter, no, she's not interested in ortho. She doesn't have ortho personality. So we'll see. We'll see what they do. They don't know any different at this point. So they have to do some more rotations and see. Anything else?
What advice would you give to young women considering a career in orthopedic surgery?
Don't give up. Be bold. Go for it. But know that you have to be strong and know that you have to be organized, right? And I would give my daughter the same advice, and that is that, a female, a mother is always the center of a household. And so if you want to have a happy personal life and a professional life, remember that when you come home, that's another job, right? And that's a very important job. And so remember that when you come, you chose that field outside and you chose this part of your life too. And so to combine them, make sure that you're organized, whether you need help from a cleaning person or a nanny, or somebody comes to your house, or you take your kids, or whatever that is, spend that extra time. For me personally, Saturday mornings are my cooking days, so I make sure that I make food for the whole week, and then we are all meal prepped and ready to go for the week. But when the kids were little and stuff, it was just easier in that way, right? And to be organized. But I would tell you is that you can do it. You just need to realize that there may be a little bit more organization and structure that you have to do, and you may have to listen to a little bit more, unfortunately. We're not 50-50, right? We're not there yet. But definitely, there'd be a lot of people who will bring you down, no matter what you do. Just don't listen. Do you want to do something? Keep going.
And then, so as I believe I'm probably the only male in this talk, so could you share some ways in which male peers in the orthopedic community can demonstrate a greater awareness and empathy towards their female colleagues, especially in terms of like challenges and experiences that are unique to women in the field of orthopedics?
I think that just treating them with the respect, right? Not thinking of them that they can't do something. When you're teaching a junior resident, whether that's a female or a male, it's the same. It should be the same, right? You don't have to say, okay, well, you have small hands, so try doing it this way. You don't have to, right? You can just say, okay, this is how we reduce a fracture, or this is what we do. If she says like, hey, I'm having a hard time, I don't feel I'm strong to do this or something, you can say, okay, if I've struggled, I've done this. Put a little bit more local in there, or put a little bit more traction on, so wait for that traction. So those things, just to be how you would want to be treated, there's no difference. You don't have to treat your female colleagues differently. Just normally is fine, and with respect, because I think you should respect your male colleagues as well.
Not to like something that I think that will be helpful, is if you see other male colleagues talking about things like standing up for your female counterparts even when they're not there. I think that kind of holds a lot more because like men are gonna listen to you faster than they're gonna listen to me. So if they say something and then I say, hey, that's like inappropriate, or you're being sensitive, da 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 da. But then 5, 6, 7 minutes later, it's just you and that person. You're like, hey man, that was inappropriate. They're a lot more likely to like sit and reflect on your words than they are on mine. So like just like keep that in the back of your head to like not that we need people to stand up for us. Obviously, I think that we're all capable of standing up for ourselves. But your words can also hold some weight.
I think that's so true. Once you are not a junior anymore, and you're more of a, next level PGY 2, 3, 4, 5, and you have younger residents and somebody is out of line, like she said, you should stay. You should stay that is inappropriate. Your program director should be saying something like that too, or your trainers. And I think that most people do, but if not, I mean, there's always a little bit like, when, like I said, we spend so much time with the residents, you get to know them. So there's a little back and forth kind of talk, and that's fine. But disrespecting your male colleagues as a male, or your female colleagues as a female, or vice versa, is an appropriate period, no matter what. So yes, if you are in a position of authority, you should stand up for any resident, any inappropriateness. Anything else?
So I think we have time for a few more questions. If you want to throw them in the chat, or just go ahead and unmute yourself and ask them, feel free to do so. And if not, we'll go ahead and sign off in a second.
Hi, I was at the AOAO meeting in Boston too this weekend, and in the women in orthopedics section, there was some statistics about like pregnancy in residency and stuff, and like a lot of it just stuck with me. Is there anything that really stuck with you that you were surprised to hear about? Like for me, it was the male program directors seeing pregnancy as like a hindrance, whereas the female program directors, like Dr. Meredith said, like she doesn't see it as a burden.
I think that that's just a culture change that's going to take some time. But like I said before, it's a personal thing, right? Do you have support? Whether you are in ortho or not, and if you are any kind of residency, any kind of job, especially a new job, you need extra support to help with your family, right? Especially a newborn or a young child. So it's not that it's a hindrance or that it's unwelcome. It's just how are you going to handle that? Will you have that support? That's the main thing.
I think also to add on to that, when you look at programs, when you're trying to like feel out if they're going to be more receptive to females, if you look at their resident list and if they have a lot of females, if they don't have a lot of females, reaching out to them, honestly, cold calling them, texting them on Instagram, or was it DMing them on Instagram, and asking them like point blank, most of them will be very receptive to you asking questions about, are they receptive to you having a family residency? Like I know, for example, like Jersey City, traditionally none of their female residents have kids, and it's just because of the work-life balance. And then some programs are more receptive to it. So like being comfortable with go ahead and cold email, cold text, DM them, and get to a point where it's just a normal conversation and asking these questions that might feel a little awkward. You just ask them directly to residents and they'll be honest with you for the most part.
Going off of that, how would you like approach residency interviews when they like ask about families? If you said like, for example, you were interested in that program and a lot of them don't have kids, but you are interested in having a family, would you just say to be honest with them and that's like the best bet? Because obviously what's meant to be will work out.
We can't ask that question.
Oh, okay.
They cannot ask you those. They can't ask you if you're married. I believe that that's a sheet of paper that has no question. You can ask these questions, and I believe that's on it. You cannot ask those questions. If you want to tell us that you're married and you have, or you're planning to have kids or whatever, that's your choice, but we cannot ask you that. Okay.
All right, any other questions? Alrighty, on that note, so thank you very much, Dr. Rehman. Thank you, Jordan, for hosting this talk. Please stay tuned for kind of our other series that we have with the programming committee, other talks that we'll have for women in medicine. Like I said, this talk will be recorded, so we can access it, and potentially your friends can also access at a later date, which will be put on the SAOAO Virtual Resource Center, and we'll put links to that whenever we do publish this video. With that, thank you everyone for attending this talk, and I hope you all have a good evening.
Thank you.
Thank you
Thank
so
you.
much for your time.